Welcome to AETCM, the Emergency Medicine channel. Today, as part of EM Rapid 2023, we are going to discuss about meningitis. You all may be knowing that brain has got multiple covering. Actually, it is for the protection of brain. There are a lot of other functions also, mechanical protection, protection from bacteria, and so many other functions are there. Some functions we don't know actually why these type of coverings are there, but basically we should know that it's a protective covering. It has got three important layers. But whenever there is inflammation of this meninges, like covering of the brain, we call it as meningitis. Some patients can have high degree fever, headache, and meningism. That we'll see afterwards what is meningism. But all patients who is having meningitis may not have all these three findings. Some patients can only have mild fever, some patients can have headache, some patients can have meningism. Early phases of meningitis can only have headache, and acute viral or bacterial infection can produce fever. Infections like chronic tuberculosis can have very mild fever. Whatever it is, inflammation of covering of the brain is called as meningitis. Encephalitis means inflammation of the brain as such, not the covering of the brain. Covering of the brain is not involved there. Only brain is involved there. That is encephalitis. But in many patients, they can have a combination of inflammation of meninges with brain, that is called as meningoencephalitis. So there will be slight difference in clinical features when we discuss about encephalitis. Encephalitis patients can have mostly altered behavior, seizure, all these things. But meningitis patients mostly they may not have altered behavior because it's only the inflammation of the covering of the brain. The brain is actually not involved. As such, brain is completely spared. But in many patients, the inflammation from meninges can spread to the brain as such, and it can produce encephalitis, that is called as meningoencephalitis. Now, these are the three important features of meningitis. It can be bacterial meningitis, virus actually produces most of the patients. Virus produces encephalitis than meningitis. So, headache, fever, neck rigidity. These are the important findings of meningitis. So, fever is a classical finding in acute meningitis. Neck stiffness is very important. Headache is also very important. Confusion, sensitive to sunlight, nausea, vomiting. These are all these features of encephalitis. Okay. But remember, patients with meningitis, many can have associated encephalitis. That's why we call it as meningoencephalitis. Now, symptoms of meningitis, classical symptoms we have already seen: fever, headache, vomiting. Then encephalitis will have altered behavior, seizures, cranial nerve involvement, focal deficit, rashes and all. Rashes may be a part of infective meningitis. Remember, focal deficits and cranial nerve involvement. Normally, inflammation of meninges, these things are not involved. But whenever there is inflammation of the blood vessels associated with this meningitis, can produce focal neurological deficits or cranial nerve involvement. Normally, meningitis means only covering of the brain is involved. But in a patient who is having focal neurological deficits associated with meningitis, we have to always think that there is associated inflammatory vasculitis. So, this inflammation can be due to infection or due to some other immune-mediated mechanism. Now, Neisseria meningitis, that is one of the most important meningitis that produces community-acquired bacterial meningitis in children and adults. So, it's very common in our country. The classical feature of this meningococcal disease, Neisseria meningitis, is otherwise called as meningococcal meningitis. Petechial rash, 1 to 2 millimeter diameter, mainly seen in trunk and lower portion of the body. A maculopapular eruption resembling a wide variety of viral exanthems like rubella. So, any patient who is having meningitis, hypotension, and generalized rashes all over the body, especially on the trunk, you have to always think about meningococcal meningitis. Some patients, these rashes may produce severe disease, that is purpura fulminans. It is usually associated with multi-organ dysfunction syndrome, and some patient can develop shock, hypotension. This is called as Waterhouse-Friderichsen syndrome. Okay, so these are problems these problems can occur in meningococcal meningitis. Sometimes patient can have only meningitis. Some patients, they can have multi-organ dysfunction syndrome. We can call it as purpura fulminans. And some patients can have hypotension and severe shock. This is called as Waterhouse-Friderichsen syndrome. This is due to bleeding to the adrenal glands that leads to adrenal failure. So, these are the common findings in Neisseria meningitidis or meningococcal infection. This highly contagious infection, we have to be very careful when we are treating this type of patients. We have to use our personal protective goggles or personal protective equipments. Otherwise, we also can develop these type of problems when we are treating this type of diseases. We can also take prophylaxis against Neisseria meningitidis when we are treating this type of diseases. Antibiotics are available that we'll discuss afterwards. Now, few important findings, clinical examination findings you can get in meningitis. One is Kernig sign. You can flex the hip joint. So here we have flexed the hip joint. Then extend the knee joint. So now we are extending the knee joint. Okay. So first flex the hip joint. Now then extend the knee joint. It produces severe pain in the sciatic area or hamstring muscle spasm can occur. So pain will be largely here. So severe pain can occur there. So this is called as Kernig sign. This maneuver stretches the roots of sciatic nerve which are inflamed at their output area from the spinal theca. So patient can have severe pain here and it will be very difficult to extend the knee like this. Okay, so this is called as Kernig's sign. It's a very important sign. Any patient who is having severe headache, fever, we have to always do this in emergency room. Now, another important finding is neck stiffness or neck rigidity. So, neck rigidity normally you can get in many elderly individuals, those who are having Parkinsonism. All these patients you can get neck stiffness or rigidity without any meningitis. A patient who is having severe headache also you can get sometimes meningism features, but they are all not the typical findings in meningitis. Meningitis finding will be, this is called as Brudzinski neck sign. You try to flex the neck, you can see the flexion of the hip joint, flexion of the knee joint, flexion of the ankle joint. So when you're trying to flex the neck, all other lower limb joints will also flex. So this is called as Brudzinski's neck sign. And you can also see the Brudzinski's leg sign, passively flexing of one lower limb, the other limb also will try to go in that position. So that is Brudzinski's leg sign. So Kernig sign and Brudzinski's neck sign is two important findings you have to see in all patients who is having headache. Many patients who is having subarachnoid hemorrhage also can have similar finding because blood is written in the CNS. That patients also can have similar finding. That doesn't mean that they have meningitis. So the neck stiffness or neck rigidity can be seen in elderly individual, Parkinson's patients, or cervical spondylosis patients, meningitis, and subarachnoid hemorrhage. But the classical neck stiffness is explained in meningitis, that's all. But you can get other conditions also. So clinical correlation is very, very important. History is very important and other examination findings are very important. Whatever it is, Brudzinski neck sign is a very important sign along with Kernig signs to make a clinical diagnosis of meningitis. Now, there are a lot of organisms which can produce meningitis. We will be discussing only few. We will not be able to discuss all these bacteria. One of the important bacteria in uh, elderly individual, that is pneumococcus, Neisseria meningitis, that's already seen, gram-negative bacilli, especially in diabetes patients, gram-negative infections are very common. Streptococcus is very common. Listeria is very common in pregnancy. So these are the important bacteria present in common organisms present in older children and adult. Young children, H influenza type B is very important. Mostly uh, many of the children nowadays take vaccination against this H influenza B. Neonates and it is like gram-negative bacilli, streptococcus, pseudomonas are very common. And neurosurgical procedures, we have to always think about staphylococcal aureus, especially MRSA. That is also very important. Other bacteria is also like that. CSF leak, streptococcus pneumonia is very important. Another important organism is Listeria. Listeria is very, very common in extremes of age. Extremes of age means in children, very young children and very old patients, Listeria is very common. Now, when the meningitis crosses more than the symptoms crosses more than 4 weeks, we can call it as chronic meningitis. One of the important chronic meningitis what we see in our countries, TB, and all patients with HIV can have different types of meningitis. TB is one of the most common meningitis we see in our routine patients. But in HIV patients, it can be cryptococcal meningitis, toxoplasma, cysticercosis, so many other differential diagnoses can be there. Non-infectious, mainly metastatic lesions, lymphoma, leukemia, sarcoidosis, all these things can be there. Now, whenever we get a patient with meningitis, we have to do LP. Mostly, we get a turbid fluid. In that, when we examine, we can see pus cells or increased WBC count, and some bacteria can be present. AFP can be present. We'll see the findings in CSF afterwards. So in meningitis, we require an MRI scan with contrast because when the inflamed meninges, when we are examining in MRI or CT, without contrast, you may not get a good finding. When we are giving contrast, that will be absorbed in an inflamed meninges, and that can be picked up by contrast enhanced CT or MRI. Nowadays, we do MRI for all patients. Now, CSF study is very, very important in meningitis. It is ideal to do a CSF study before the antibiotics, but unfortunately, many centers it will not be possible. We'll have to start the treatment as soon as possible. We should not wait for CSF study to start antibiotic, but if possible, try to do CSF study before antibiotic. So we are discussing about meningitis. That's why we are only focusing bacterial and tuberculosis. Cell count will be very high in bacterial. It will be slightly lower in the tuberculosis. But later stage of tuberculosis, you get very high counts, and glucose will be low in both TB and bacteria. Most of the bacteria utilize the sugar in the CSF, but we can see here in viral infection, it's always normal. So low sugar always indicates an bacterial infection. CSF protein always elevated in all types of infection, even in inflammation due to non-infectious disease also, it can be elevated. And gram stain will be positive in, can be positive in CSF study in bacterial infection. Here AFB can be positive. So treatment is very, very important for all patients who is having meningitis. We have to start the treatment as soon as possible. I will not be going to the details of all types of treatment here. But remember, any meningitis, any patient come to emergency room, we have to give a multi-drug regime. In that, vancomycin is very important. You know that vancomycin can treat gram-positive cocci, most of the gram-positive cocci, including MRSA. Ampicillin should be added in elderly or very young children because we are treating listeria with ampicillin here. Or we can straightly go to meropenem. Meropenem dose is very high in meningitis, 2 gram IV, 8th hourly. there is a dose. Other drugs, depending on the clinical scenario, we have to select. So triple drug regime like vancomycin that covers gram-positive cocci, including MRSA, ampicillin in extremes of age, and cefepime. Cefepime is mainly given for gram-negative organism. So a gram-positive drug with gram-negative drug, or you can even go for basic drugs like ceftriaxone with CP, crystalline penicillin. Crystalline penicillin mainly covers gram-positive, ceftriaxone covers gram-negative. So that also can be given. But ideal scenario in a tertiary care center, we have to give meropenem with vancomycin. That's also very good choice. Meropenem covers most of the gram-positive infection, gram-negative infection. Vancomycin covers gram-positive, especially MRSA. Listeria should be given covered with ampicillin, so that can be given in extremes of age. Now, early antibiotic and steroids are very, very important. In a routine setup, we try to give ceftriaxone that covers gram-negative, or cefixime or cefotaxime. Vancomycin covers gram-positive, including MRSA. If the patient is having altered behavior, always try to cover viral with acyclovir. And once you make a clinical diagnosis after LP or CSF study, you can switch down to only antibiotic. So that should be started immediately. But before starting antibiotic, especially in streptococcal pneumonia infection, that capsulated organism, you have to always start dexamethasone. Because once you start antibiotics, these antibiotics can kill the streptococcal pneumonia. That covering of the bacteria that can produce severe inflammation in the CSF or meninges. To prevent that, before giving antibiotic itself, we have to give dexamethasone. Once you rule out streptococcal pneumonia infection, you can stop the dexamethasone. But if it is tuberculosis, it is better to continue the dexamethasone because it can prevent adhesions. So we have discussed about an important problem in emergency room, that is bacterial meningitis. Once the patient is having predominant encephalitis, we have to think that it can be due to viral or some other organism. Bacterial meningitis, remember, you have to give a contrast enhanced CT or MRI. Dexamethasone should be given before antibiotic, and antibiotic should be started. CSF study will help you to differentiate various types of infection in the brain, and according to the CSF finding, you can step down or step up the therapy. Thank you.